All right, welcome back. And just before we go on the home stretch and listen to that kind of music that you just heard there, we'll have to talk about a review of the health sector in Nigeria after 54 years. I guess a lot of people will look at what has happened over the last few weeks or the last few months and say that, oh, our health sector has done well, not bad at all. But then we can't use that as the only yardstick for what has happened in the health sector over the last 54 years. To have this conversation with us, we've got on my right-hand side Dr. Adeyeye Arigbabuwo, Deputy National President, Healthcare Providers Association of Nigeria. Good morning and welcome to Sunrise.
Thank you.
And on the other side, we've got Dr. Cyril Chukwu, who's a Consultant Pulmonologist at the Lagos University Teaching Hospital. Good morning and welcome, sir.
Good morning. Happy to be here.
Yeah, we were just talking about your profession and also looking at the fact I was thinking that consultants are almost like God in the health sector.
In the health sector.
All the other doctors defer to them. If a consultant comes in and says, this is it, everybody say, that's what the consultant said, so they have to do. Now, if you were to look back many, many, many years, over the years that you've had to go to school and all that and experience the health sector, even before you became a medical doctor, how would you say we have done? This is 54 years on.
Well, mixed feelings. But overall, I think we've gone back. I went to medical school in Nigeria in the 70s. And the university then was an international place. In my medical class, we had students from all over the world virtually.
Which university was this?
University of Lagos, College of Medicine. 74 to 79 class. We had students from Zimbabwe, we had students from South Africa, we had students from Kenya, Tanzania, Uganda, UK, Canada.
Possibly India as well, where we all
India,
go now.
Pakistan, yes. Students from India, Pakistan. What, Ghanaians schooling in Nigeria in the 70s. That is no more. Now, we had facilities comparable to whatever you can get anywhere in the world. We had elective students coming from UK university, Canadian university, even American universities. They come for 2 months, 3 months. That doesn't happen anymore. And you qualify as a doctor in Nigeria, you go anywhere in the world, you can work. That is no more happening. Medical schools these days, only Nigerians. In fact, there are more Nigerians reading medicine outside Nigeria than in the Nigerian medical schools. The best teachers have all gone outside the country. The facilities, so when I look back at my medical school where I was in the 70s, I look at it now, I say, no, where did we go wrong?
I was about to ask you that question.
Where did we go wrong? Facilities have gone back, students, even the libraries. Oh, we had libraries that people were coming and those things are no more.
What is different now?
It's not as good as it used to be. You could get up-to-date journals, up-to-date textbooks. Those days, if you see a book that is 10 years old in the library now, you will be very happy. And of course, medicine is a fast-moving area, and if you have things that are 10 years old, that means you are just 10 years behind. Now, what went wrong, I am not in a position to know. Is it that the money is no more there? Or the money is there, but the money is flying away? I just don't know.
So in the midst of all of this, we still have the hope and the shining light, like the first consultant and the number of other people who have worked together to move us from the realm or from the edge of catastrophe that Ebola could have constituted for this nation. So let's sing the praises of the good things that has happened.
No, very true. Very true. That's why I said it's mixed feelings. Mixed feelings. But the tempo The tempo now is far behind the tempo 30 years ago. Yes, it's not all bad news.
So what are the good news? If you talked about the bad news, and that is quite depressing. But where's the good news? Where should we be looking at and saying, in this area we've done well and we should be working to improve on it?
Okay, my take there is this. Let us see how we can reinvent the good old days. Because life is a continuum. If you are moving at, let's say, this pace, and you slow down, you look back, you see that you have slowed down. But we want to move faster, move better, or at worst, retain the same speed. A situation where we had people coming to learn medicine in Nigeria 30 years ago. Now we have Nigerians going out to learn medicine. It's not all bad, but you see that we have moved backward. A situation where you had libraries, Nigerian doctors will go to UK and pick up a job. It's no more. You see that, yes, we have not completely disappeared, but we're not as good as we used to be.
Okay, let me ask Dr. Arigbabuwo. We've heard from Dr. Chukwu in terms of what used to be and what is now. I'd like to ask you, first of all, what are the things that we can look at and say we deserve a little pat on the back, especially looking at what has happened in the last few weeks? Because if we don't acknowledge some of the good things we've done, it means we're really not appreciative of it.
Thank you very much. In trying to do what may sound like balanced reporting, I would want to look at the fact that, one, if you remember, or let's just recall, in the 60s, say between 62 and 1968, we had our first indigenous national health plan, development plan. And again, 70 to 75, we had the second one. 75 to 1980, or thereabout to 82, we had the third. And like the era my colleague was talking of, yes, we had the fourth one, even from the 80s to 1980 to 85. Probably he was leaving the medical school when I came in, so to say. But I think if we look at it critically, I mean very well, we will know that it's been a learning process, and we haven't gotten it all wrong, really. Well, for example, our response to national disasters, or maybe what I would call some outbreak, like we recently had in the Ebola situation, for example, is the Lassa fever and things of that. What I can call national emergencies have been quite commendable in the recent times, so to say. At least for the first time, having something alien coming to us, diagnosed by the Nigeria community, handled by the Nigeria community, and I will also say contained, as it were, by the Nigeria community, even at a cost, as it were, I would say was highly commendable. At least the Federal Ministry of Health, going with what the Lagos State government did, and then the public sector, the private sector, all of us coming together, forming a matrix of a critical mass of health specialists coming into handle that particular situation with precision. And I think as it is today, it's good news. For example, even the international community, they commended the efforts of Nigeria. But then we look at it again, we begin to ask ourselves, yes, what's our health budget like? Are we getting it right? Well, today we haven't still gotten the 5% minimum recommended by WHO. And not only that, the medical schools and the curriculum, probably they still remain a little bit stagnant and ancient as they were. So to say, no new method of learning, as it were. Even when we now know that our medical students have now become used to e-learning. For example, textbooks are probably no more selling as much as they used to be, like my guy was talking about. They now do e-learning. I don't know now whether students take notes again in the classroom, because most of the things are now by ICT or whatever it is. But I want to recall Professor Olukoye Kuti of late and blessed memory, how he taught us, for example, he championed the fact that tropical medicine, we could lay our hands on clinical acumen, for example, to handle our patients, to even see the possibility of treating with limited modern weaponry, so to say, of making diagnosis. And so to say, and I think with clinical acumen, Nigerian doctors are quite sound. And when we move out into the international community, most Nigerians, because our register shows about 65,000 doctors who are Nigerian doctors, and about 40,000 are just out there, leaving about 25,000 in Nigeria. But where those 40,000 are, they are at the forefront of most health institutions in various what we call a continent of the world, for example, even outside Africa, and they are doing virtually very well, especially those in the diaspora, like I'm trying to say. But then we're also seeing a way now to entice them back to the country, but we must create enabling environments for them, like it's been done in India, for example.
All right, you're the Deputy National President, Healthcare Providers Association of Nigeria.
Yes.
What has been the biggest challenge so far?
That association has been a very peculiar association, trying to marry all the various professionals together under the same roof. And that association is addressing doctors,